Okay, sorry.
It's all right.
Yeah. So I'll yell and I'll be careful. Will you be able to sleep with that, Eric?
We'll probably hear it over here in Minnesota.
Yeah, it's still sketchy if you carry on with the way you're doing it. It's sketchy to me.
I'm hearing change nothing, but all these things happen.
Yeah.
Okay. All right. You're still having a normal diet, and you're
what?
Your normal diet, and you want to make any changes on your diet, on your food? Any changes? You want to make any changes on your diet?
Any changes in my life?
No, your diet. In your diet, in your food.
The food.
Yeah.
More burger.
It's a blanket.
Yeah.
No problem.
No problem.
But let me tell you, every now and then there's been a few little slips. And Jane has kindly helped in one department, and it's worked like a charm. She's put an arrow up so people know I have a room back here.
Yeah.
So once again, I'm getting afternoon tea regularly. Yeah.
Yeah.
Worked like a charm.
Yeah. So your weight has been stable. No weight loss.
No.
Yeah.
I mean, you've got to expect the kitchen to have
your
problems too.
Yeah. Your BMI is normal. Your weight is 68.3.
Slower.
Your weight is 68.3 kg. That is totally fine.
I'm not getting it.
Your weight.
Write it down.
There.
Oh my, yeah.
Your weight has been normal.
I'm happy with that.
No weight loss.
Yeah.
Yeah.
No offense, Hannah, but you have a very strong accent.
It's the mask. You can't see the lips.
I know it's difficult with the mask on.
Well, no, I'm struggling a little bit. Your accent is rather heavy, and I'm also having streaming problems through Skype.
Yeah.
Your accent is very thick.
And your accent isn't?
Yeah, you accent. Up here in Minnesota, we talk normal like ordinary people.
Mine is also not muffled with a mask.
Oh yeah, with the mask it's very difficult. And she has been using a walking frame and as well as wheelchair for long distance and walking frame for the short distance. And the physio is also coming here to practice with the walking frame. And that's been going on.
It's getting harder with the walking frame because of my leg, isn't it? The spasms and the cramps and the pinching has made it so painful. I can't stand on that leg. So the codeine is helping.
Yeah.
But not.
Yep. Use it.
So at present, one person is helping her with the shower and with the personal cares and everything. And she always calls for her assistance if she needs any help.
No, I'm happy with my help in the shower.
Yeah.
Joanne, I'm going to ask the doctor to look at your pain medication.
The doctor has looked at it.
I'm going to ask him to look at it again because obviously we're not there yet. If it's affecting your mobility, we need to look again.
Regarding the knee, an increase in the knee.
Yeah.
Okay.
All right.
So put my name on the list.
Yes.
Yeah. Dr. Marsh, here I come.
Absolutely. You've got to keep you walking.
Yeah.
Okay. Where'd Eric? Oh, Eric's probably gone to get a cup of tea.
He fell over from the.
No.
Yeah.
I'm wandering all over my house to find the best signal because you're cutting in and out and freezing. I'm not getting a steady stream. I'm catching every third word.
Are you on that AT&T carrier still? That thing or yeah, that's probably it.
I'm not picking you up.
How often does a doctor attend? Is it like a month or 90 days or on call by item?
Joanne will be seen every 3 months routinely.
Thank you.
And extra on top, but the GP is actually here 3 times a week.
Very good.
Yeah.
Okay.
The option has always been there.
Right.
Yeah.
And yeah, night routine has been really well. She sleeps well during nights and wakes up occasionally for toileting.
Are you talking about me sleeping like a log?
But you wakes up in between for toileting.
Yeah.
At night.
Yeah, in fact, I'm getting better at sleeping.
Yeah.
I was only up twice last night.
That's fine. So there has been no mood and behavioral issues from her side. Your mood remains to be stable. No behavior concerns.
I didn't get that.
And for the skin, apart from the leakage from the legs.
Sore. The pain in the legs are the only problem.
The pain and the leakage.
When you had, because you had that dressing on your leg for a long time, didn't you? Because your leg was leaking.
Oh, the leaking problem.
Yeah.
Yeah, that has cured itself.
Yeah. Apart from that, there has been
Question regarding leakage, edema, leg. Is there any way that of a period of elevated leg height would drain back some leakage, or was it handled just by time it stopped by itself? Did she raise her legs to incline a less downflow?
but it has been resolved.
My legs look like 3/4 of the ladies in this ward. Oh, I know what you mean. Yeah, because your mother-in-law used to sit with her legs elevated for the same problem of the edema that she had. And she just would stop what she was doing, lie down on the couch and put her feet high in the air. Yeah. Does she still do that?
Well, actually, she has had dizziness and been taken to hospice as her next stage. But you're right. Every twice a day, she'd lay and raise her legs to control edema and seepage and leakage, and she seemed to be helped by it. But I suppose it'd be trouble for you.
Yeah. Well, Alice is now in the rest home, and I'm sure they're taking care of it.
I'm sure.
Okay.
Well,
Can we not talk about Alice and stay focused on the present matters at hand?
We are, Sally, and I see that if you have edema, one of the remedies is raising the leg, Sally, and they probably tried other things. Things will not. Yeah, that's right, Sally. Up, but they're doing different things. So we're good.
If it makes you feel better, Lars, I always sit with my legs up.
She always sits with the
always.
legs up. Yeah.
Handstand, Mom. You gotta learn how to do handstands.
Handstand. All right.
Upside down in a harness, swinging.
Oh my God.
Anti-gravity chairs.
I would.
One of those anti-gravity chairs.
Okay, so yeah, apart from that, there's no skin issues that you have. And she is pretty much good with the activities, especially the games here. And the activity coordinator
Excuse me, Hannah.
Yeah.
Hannah, I'm sorry to pause you real second. So her head now is completely resolved? Were you saying no skin issues? That has totally been resolved?
Yes.
I'm not thinking.
Your head. You know, when you had your lesion removed from your head.
Oh,
Yeah.
the skin
Yeah,
cancer.
yeah.
Yeah, that skin cancer is long gone.
Mm.
I still, yeah, I still have the keratoses, but they're all over my body. Everything from little pimples to, and they just pop up. Look, I've got them in everywhere. They're under the bandages because I knock the tops off all the time. And
Is it something that needs monitoring?
then there's no cure for keratoses, warts.
Froze.
I think if you scrape them off, you can smoke it in
You
a
froze
pipe
up.
and it's
I
good.
didn't catch that.
You have a lot to learn about old age.
I'm just asking questions so that when I get there, I won't be
Yeah, no, this
uneducated.
is very good. The donor site for the skin graft was every now and then I would feel it was pulling, but now that's getting much better and doesn't bother me anymore much. That was the donor site for the
So there's no concern
skin graft.
and monitoring. We shouldn't have to worry about monitoring that from this point.
No.
Anna?
I'm hoping now from now on my head still remains screwed on tight.
How's the eye? The eye that you had one eye left?
What's that?
Eyes.
My eyes.
Yeah.
Well, they're pretty static. Yeah, they're static.
It's
Yeah.
stable.
I haven't. I read a lot, you know.
Oh yeah. Oh yeah.
Good books and bad books and naughty books.
Uh-oh.
I-
Books about rest homes.
Yeah.
She's
Oh,
taking eye drops daily for that.
Yeah. No.
And
All right. I apologize for
Every-
interrupting.
Camino Island. He used to live near there. He said it's all filled with ritzy houses.
Oh, I see.
I suppose next book will be about a plot to launch an epidemic and the whole world's sick. That'd be a great work of fiction. That'll never happen.
Is he having at me again?
Yeah.
Well, I'm glad I didn't hear it.